Greetings, I'm Dr. Juwairia, consultant cardiologist and heart failure specialist from the United Arab Emirates. Clinical management of patients with heart failure is becoming increasingly complex since heart failure patients frequently have comorbidities, and recent data suggests that almost 90% of patients have 3 or more comorbidities. Iron deficiency is a common comorbidity in heart failure, with studies suggesting it's present between 1/3 and 2/3 of patients, depending upon the cohort of patients evaluated. Iron deficiency is a chronic disease that can be defined by a serum ferritin of less than 100 microgram per liter, or if the serum ferritin is higher, between 100 and 299 microgram per liter, a transferrin saturation of less than 20%. Studies in heart failure have consistently shown that the presence of iron deficiency is associated with impaired exercise capacity and tolerance, impaired health-related quality of life, and also adverse prognosis, both in terms of the risk of death and the risk of heart failure hospitalization. And the adverse prognosis is independent of a number of well-established prognostic variables, including hemoglobin. Iron deficiency can be defined as being absolute when body stores of iron are low, typically when serum ferritin is low, and that is often seen in patients with reduced oral iron intake or excess loss, or a combination of both. However, in chronic diseases, where inflammation is the hallmark of that disease, and heart failure is one example of that, then functional iron deficiency occurs. And in this situation, the body seems to have adequate iron stores, but it's hard to mobilize the iron to where it's needed. Iron is needed not just in heme for the transport and delivery of oxygen, but it's also needed for optimal cellular function, and particularly for mitochondrial function and oxidative phosphorylation. So in summary, iron deficiency is very common in patients with heart failure, both with and without anemia. It's an independent predictor of impaired exercise capacity, quality of life, and adverse prognosis. Ongoing large-scale trials are going to help define the optimal role of intravenous iron for the treatment of patients with heart failure. Thank you.